Hey, this is Chris Fox. This is my response to the GI bleed video. Our patient noticed that he was feeling weak and dizzy and was more short of breath, which was abnormal for him due to him being a healthy and fit male that worked out a lot. Our patient then experienced a syncopal episode after he came home from Hawaii, and that's what caused him to be admitted to the hospital, which was discovered that he had a bleeding ulcer. During my assessment of this patient on scene, I would ask him if anything is abnormal, if he's been feeling differently lately in any way, if he's been weak, if he's had any cardiac issues. I would check his blood glucose. I would get an EKG 12 lead. I'd ask him if he's been having any abnormal vomiting or diarrhea and what it looks like, the consistency of it, and if he's been having any heavy drinking, heavy smoking, any partying more than recently due to this being on a college campus. For his SpO2 levels, specifically, those would be decreased due to the decreased number of hemoglobin he had in his blood, and his pulse rate would be elevated. His respiratory rate would be elevated as well. His skin signs would be pale, and then we would see an end-tidal CO2 level that would be low as well. For the field treatment of this patient, we want to make sure we get them fluids to replace the fluid volume loss that they're already experiencing. Also, we want to make sure they're getting oxygen via non-rebreather, get that oxygen going because the patient is losing oxygen due to the decreased number of hemoglobin in their blood. So they're not getting oxygen delivered to all their tissues due to the bleeding that's happening in their body. And then I would want to make sure our patient's also hooked up at end-tidal CO2 so we can see how our cells are doing with the cellular smog check that end-tidal CO2 is. We want to make sure we get an EKG just to make sure there's no cardiac involvement and we don't have any infarction starting from the lack of oxygen delivery to the tissues. And we just want to make sure we support our patient with fluids, with oxygen, and we know where we're going, preferably somewhere with internal surgery that could correct the bleeding. So a trauma center would be my best guess is if that's where we'd want to go, so we don't have to risk this patient being transferred for the sake of higher level care. And that's all I would say.